The first report of a successful cord blood transplant was about 25 years ago. Those blood has what we call stem cells, and they are able to repopulate the bone marrow. Since that time, there have been significant advances in understanding the use of cord blood for the purpose of stem cell transplantation.
I think the most exciting things in cord blood transplantation and cord blood banking are really just the continued growth and the acceptance of cord blood as a standard of care in treating patients.
The standard application of cord blood is to treat diseases that involve the bone marrow or the immune system. So most commonly is used for treatment of patients with leukemia, lymphoma. They also have been able to use this kind of cells for babies who are born with our immune system.
Valentina was born May 25, 2010. Everything was fine until she was 5 months. She was in the hospital for about a week. We went home and she wasn't gaining weight. She was losing weight. She wasn't eating. We would take her to the doctor almost every day. They told us that she had to have a bone marrow transplant because she was diagnosed with SCIDS, a severe combined immune deficiency. There was no other treatment for her but to get a new immune system. We have been here for a month and they told us that she was a candidate for a bone marrow transplant, but they were going to get it from a baby's cord blood. We took the chance and it was the best thing we could do. Cord blood changed my life, our family, and my baby's life forever.
In children, 20 to 30% of all the transplants are now using cord blood, and the number is going to go up. In particular to the Hispanic population, ethnic minorities, this would be very useful for them to find the best donor, and this will increase the success rate of the transplant treatment.
One of the most important things about the Texas Cord Blood Bank is the diversity of the cord blood units that we're collecting. And this genetic diversity is really what makes a cord blood bank so important, because we have the potential to use these units for patients all throughout the world. And this is something that's really exciting and fairly unique to the Texas Cord Blood Bank.
My wife and I, Darlene, had a son that was born with sickle cell anemia, and he had to be hospitalized about every other month or so. The doctor came and told us that his sickle cell anemia case was so severe that he may not reach his teens. So we were trying to find something to do, just get him to live a little longer. Our doctor told us about cord blood stem cells. After searching and not being able to find a match for our son, my wife got pregnant with our youngest son, Isaac, and when they did the testing, he was a perfect match. We were able to use his sample and cure our son. Once we got him his cord blood stem cell transplant, our son just miraculously changed into a normal little baby. He could do everything that any child could do. He didn't have to take any medications, and to this day, he has not had a single sickle cell crisis again.
The Texas Cord Blood Bank is now one of the largest public cord blood banks in the United States, and it is our only public cord blood bank in Texas. So it's a very important resource, not only to people in San Antonio, but to people throughout Texas, throughout the United States, and throughout the world. People that are having a cord blood transplant have potentially fatal diseases, which can only be treated with stem cells. And these stem cell units that are being processed and saved at the Texas Cord Blood Bank represent their chance at a cure.
John is 16. He was diagnosed with leukemia at the age of 10. Already being in 3 years of chemo, he relapsed, and we were told his cancer had come back pretty aggressive. The doctors told us there's no more chemo that we could do. Either we can go home and enjoy his time, or we can maybe try a bone marrow transplant. So I took it upon myself to educate my family, and one of the options were cord blood. The chances of finding a donor were very slim, but then we got the news that we had a match, and it was the cord blood. The actual transplant itself, it was so easy for him. The 6 years of challenge with the leukemia have been erased. You hold your precious baby when you give birth, but you're also holding someone else's life. And if you donate your cord blood, you're giving life when you do that. Just like they gave my child. They gave him life all over again.
Collecting cord blood can be done either before the placenta is delivered or after the delivery. Either way, it would not affect the delivery process.
There's no pain, there's really no risk of any way. It's something that would just be thrown out if it wasn't used. So this is why it is truly a life-saving miracle that it's just so important to save as many units as we can. Many units which are not used for transplant are sent from the Texas Cord Blood Bank to research facilities around the country. These researchers are researching an incredible array of different diseases that stem cells can be utilized for. And it really leads to this whole new field of regenerative medicine. And this is utilizing cells for cellular therapies to treat diseases which otherwise could not be treated. But I'm really happy to say that there are actually clinical trials going on all throughout the United States now and throughout the world utilizing cord blood stem cells in all these regenerative medicine applications. So it's a really exciting time in the field.